Hi, my name is Dr. David Marquis, and I just wanted to take a few minutes and talk to you about our approach to treating thyroid dysfunction. It's a very common disorder that many patients present with, and we more often than not find that there's been a few things that have been left on the table, so to speak, in determining the underlying cause of an individual's thyroid dysfunction. And it's just a wonderful experience to see someone get that corrected. It's not always overnight, but if there's enough patience and diligence in terms of following the protocols, we have a pretty high success rate. And so what I'd like to go into is some of the common mistakes that we see when patients come in, and then explain how we treat things a little bit differently there. First off, I have all of my patients complete a quite detailed intake sheet so that I can get an understanding of their past history and everywhere that they've been, all of the different doctors that they've seen, and I encourage them to bring in as much of their lab that they have, particularly for the past couple of years, so that we can start to see some trends in terms of objective lab findings. So while we're looking through their history as well as the objective lab findings, some of the holes that we will commonly see is that they might have had positive thyroid antibodies or not had their thyroid antibodies tested previously, so their panel, in other words, wasn't complete. Their panel might have been tested for just a TSH, T3, T4, and that would be it. And if the TSH was elevated, then they said, well, you've got hypothyroidism, let's put you on some levothyroxine or some Synthroid or Armour, or, you know, there's so many different ways to approach that, but all of them are essentially the same. We're going to replace what we think you don't have. Well, that's an approach, and when you look at thyroid as a whole, there's fundamentally 6 categories there. And that first category, primary hypothyroidism, it'll respond to that protocol. And so for those folks, albeit the least amount of the people who are suffering with thyroid, they're going to hit the ball out of the park and they'll find their problem resolved. For the other 5 out of 6 patients that are dealing with their thyroid disease, they might get their numbers corrected. That TSH might actually show some improvement, and so the doctor and the patient, they feel a little bit of success because they see some number changes there, but they don't feel any different, and they're still suffering. You know, they might still be having hair loss, or they still might be having weak nails and fatigue and gastrointestinal problems and foggy brain, and you can go down the list. If you're watching this, you probably have thyroid dysfunction, and so you know what you're dealing with, and you get frustrated. Well, when I see those patients and I realize that, okay, they've been on this med and they're still suffering from the problem, although their numbers have been brought back into norm a couple of different times, we need to look a different direction. More often than not, 9 times out of 10, those patients are going to be having an autoimmune problem driving that bus. And that autoimmune problem has not been addressed. And that's where the different types of thyroid antibodies really come in handy. But not only the thyroid antibodies, it's why is your body producing antibodies against itself? Well, that usually comes down to something metabolic that's gone wrong in the gastrointestinal tract. For example, as your TSH starts to elevate, your gastrointestinal tract starts to become hyperpermeable. So your foods aren't getting digested as well. And in fact, some of your foods are actually leaking into the bloodstream. You're getting small particles of food getting into the bloodstream that were undigested, and your body can't do anything with that. The only thing it can do is attack it. So it builds an antibody against it. Well, every time you eat that food from that point in time, guess what happens? You get a little bit more inflamed because now you have antibodies against that food. Interestingly, many of these antibodies, particularly the gluten and gliadin family, which is wheat, oat, barley, rye, and spelt, and then you have some cross-reactive foods, they look morphologically in terms of shape very similar to our glandular tissue. So you're eating those, you've got antibodies against them, and now it's attacking that and you. So the more that you eat it, the worse the problem gets. And although you might be able to supplement with some of the hormones that your body's no longer able to put out because of the thyroid dysfunction, because of the antibodies, your numbers get a little bit better. But you don't feel better because you're still feeding that metabolic machine. Well, given enough time and allowing those antibodies to further exasperate the whole problem, what's going to happen is you're going to end up with neurological issues. And that's where people start to see that their brain gets a little bit foggy, or their sleep cycle starts to get disrupted, or they start to end up with cold hands and feet. They're not able to regulate their temperature as well. And that's because the brain has a certain firing order in which it's supposed to be working. And the more inflammation that you create because of these antibodies, well, the more inflammation starts to affect these regions of the brain, glandular tissue, gastrointestinal tract. The more that happens, the worse your health becomes. Allow that to progress, and you start to be diagnosed with other issues. And eventually they will diagnose you with some autoimmune things. And they'll say, well, you're hypothyroid, but you also have colitis, or you also have lupus, or, you know, there's so many different areas that the body can diverge into once an autoimmune pattern is starting to be turned on. In our practice, we look at you both metabolically and neurologically so that we can evaluate both those sides and then correct them. We help people to understand this process and what's gone wrong with the appropriate lab work. Wherever there's been lab done that didn't have all the details filled in, we fill those in. And then we show you how to correct it by healing the gastrointestinal tract, turning off the autoimmune problem. And interestingly enough, when you do that, more often than not, the thyroid starts to function appropriately again. The brain starts to function more appropriately again. And those symptoms that have plagued you for so long start to subside. That's when we can start to help the body to go into the repair phase, and we'll start to introduce things to rebuild that brain, like interactive metronome, auditory stim, visual stim. We'll use sound therapy. We'll use oxygen, because we creatures, we human beings, need two things. We need fuel and activation. So many of us are running around so inflamed that our ability to metabolize and disperse oxygen through our body is diminished. But we can help retrain that by using things like glutathione, nitric oxide, exercise with oxygen therapy. There are so many tools at our disposal to correct the condition of thyroid dysfunction that I could go on for another hour. It's actually quite difficult for me to put this into a less than 10-minute video. So I encourage you, if you are suffering from any of these symptoms that I just talked about, or you know you've got thyroid dysfunction, take the time to browse through our website a little bit more. Call our office. Talk to the ladies there at the front desk. They will take the time to help you. Schedule an appointment so that we can sit down together and go over everything that you've done up to this point and see if we can't fill in the pieces of the puzzle that are missing. I really appreciate you taking the time to watch this, and I wish you the best of health. Thank you.